talked about for the last 2 years of how we help people get a better understanding of working in Aboriginal primary health care in all the different forms we do that in the Northern Territory, and how to do that so it's actually effective. In 2012, NTGPE made it compulsory for all our registrars to do an Indigenous health training term, spending at least 2 days of a 6-month term in an Indigenous health setting. And when we set about doing that, we were slightly nervous that some people would find that difficult, and that for some people it would, for them or for the community, potentially not be culturally safe. So AMSANT has worked incredibly hard with us to put this together this morning, looking not only at community-controlled services, but the whole range of primary health care delivered to Aboriginal people across the Territory. And some of the AMSANT people will be here later this morning to talk to us about this. So thank you to everyone for coming, and thank you to those who've been involved in putting it together. Across the NT, all sectors of the health services have committed to ensuring that as we move forward in primary health care, we move towards community control. And that means that we give back the direction of the health services to the communities to whom we're delivering health services. And for people who haven't worked in community controlled services, this is a different way of thinking. In the Territory, when we have our registrars and other program participants learning in Indigenous health, because of the fact that that's a journey we're moving towards, a lot of our registrars will train, as I did, in non-community controlled health services. And so we thought it was really important in this workshop to highlight what a community controlled health service is and why that's our aspiration for the Territory.
Good morning, everybody. So I'm here to talk about the Aboriginal Community Controlled Health Services. I'll talk about the broad definition and aspects of Aboriginal Community Controlled Health, and then I'll talk a little bit about some of the services and AMSANT itself. So as Tamsin's kindly introduced myself, I am a local Aboriginal woman here, born and bred in Darwin. I'm the Workforce Policy Officer at AMSANT. I'm also the team leader of what we've established is the Workforce and Leadership Support Unit at AMSANT. Often what we find within our sector is we tend to work in silos because of the fact that we're so program driven by funding that, and not very long-term funding, that we often find we do our roles and then not actually work together. We've found that it's very important that we link together, that there are common themes across the roles. And now that we've established the Workforce and Leadership Support Unit, it's really come together a lot nicely, and we're building our capacity to strengthen relationships and networks. As Tamsin said, I'm also a board member of Dinilla Health Service. I have been for the last 5 years. It's been very rewarding for me. I actually started off at Dinilla in '99 as a trainee, as an admin, executive assistant to the CEO. It's been very rewarding to watch over the 7 years that I worked at Dinilla to look after a number of CEOs throughout that time, to look at different leadership styles, different aspects of why they're working within the sector, the passion, the commitment that they have. It inspired me to stay within the sector. So I've been working within the sector now for 14 years, and I also worked at the CRC for Aboriginal Health in between Dinilla and AMSANT. So what is Aboriginal Community Controlled Health? So NACCHO's definition is that it was initiated by a local Aboriginal community, governed by an Aboriginal body which is elected by the local Aboriginal community, delivering a holistic and culturally appropriate health service to the community which controls it. For me personally, I have a more simpler version of Aboriginal Community Controlled, and it is basically owned by the people, run for the people, for the community. So the whole idea, I suppose, for Aboriginal Community Controlled is to be able to get the communities to actually look after their own health, to be able to say what they need, what they think about health, the fact that they've got their own traditional medicines, their own ways of dealing with health issues, compared to Western medicines, where I think now that there is starting within the community controlled sector to be able to accommodate for both medicine, both treatments.